Purpose. The teaching plan is being taught today to teach MS, a 68-year-old female construction worker who suffered VTAC yesterday, what VTAC is, the clinical association, the ECG characteristics, clinical signs, and treatment.
Hello?
Good morning, Mrs. S.
Hi.
Welcome to Anchorage Clinic.
Hi.
Can you tell me if you have ever suffered from VTAC before? Before yesterday, before you experienced this at your job?
No, I don't think I've ever felt like this in my life. I don't take any meds on a regular basis, so I don't know what's going on.
You don't take any kind of medications for your heart?
No.
Okay, do you know what this condition is? Have you ever heard of ventricular tachycardia?
No, I have no idea. All I know, it must be something really bad because my heart's beating really fast and I need to know what's wrong with it and how to fix it.
The nurse assessed her patient for strengths and weaknesses. She is accepting of her heart condition and is willing to seek treatment, which is an emotional strength. Her physical weakness is the workload of her heart due to her job. MS will be able to state what VTAC is and how it is treated by the end of this teaching lesson.
Okay, Mrs. S., this is the structure of your heart.
Okay.
What happens is your blood comes in right here through the superior vena cava. This is your right atrium and your right ventricle. Basically, your right ventricle squeezes twice as fast as your atria.
Oh, I see.
Which means your heart isn't being able to squeeze adequately, so your cardiac output is decreased.
Okay.
Which makes your heart rate speed up.
Okay.
This is life-threatening because of the decreased cardiac output. So here's a normal rhythm of your heart, right? And this is what VTAC looks like.
Oh, man.
Yes, the heart rate is 150 to 250 in the ventricular down here. You can't see the normal waves from the first one. See, this is your P.
Oh, yeah.
Your Q, R, S, and your T. That makes one beat.
Okay.
And these are all your beats.
Oh, okay.
Can you tell me if you drink a lot of caffeine or alcohol, or do you smoke at all?
Well, as you can see here, I drink this coffee every morning. Occasionally, I have an alcoholic beverage on the weekend to relax, but I don't smoke. So, mainly coffee.
Okay. Well, these associations alone can cause PVCs, which a PVC is a preventricular contraction. And tachycardia is a run of 3 or more of those.
Okay.
And you can get a PVC every now and then from caffeine or smoking or alcohol.
Okay.
And when this happens, we don't have adequate perfusion. So then we start having issues such as you can have a heart attack or coronary artery disease. You can have an enlarged heart. You can have central nervous system disorders. And I showed you on the chart here how your heart isn't adequately squeezing properly. So this can cause your blood pressure to go down. You can start having some swelling and edema. You can go into cardiac arrest, and this can eventually lead to VFib, which is life-threatening. When this happens, if this ever happens to you again and you're in a stable environment, you are stable, we can give you some procainamide, some sotalol, amiodarone, or lidocaine. If you're unstable, we're going to need to give you some amiodarone and probably cardiovert, just restart and shock your heart back to a normal rhythm.
Okay.
This is life-threatening, like I said, and we could do CPR or defib if this ever happens again.
Okay.
Do you remember what VFib is?
Yeah, I think you said it's something like a run of 3 or more PVCs in a row, and that maybe I could get it from drinking my coffee.
Yes, that sounds like you really understood. Do you know how it's treated?
Well, you said something about IV amiodarone.
Amiodarone?
Yeah, that's it, yeah.
Do you remember anything else? About maybe some of the things that might cause a PVC that you do every day?
Yeah, drink my coffee, my alcohol on the weekends. I'm definitely going to cut back on those.
Well, you might want to drink some water. Maybe we should switch to some water.
Okay.
You can hydrate yourself. Do you have any more questions right now or any concerns?
No, really, I'm just tired. I think I need to go home and get some rest, and
Okay.
I'll come back in 3 days to check up with you again.
Yes, we'll do a checkup in 3 days, okay?
All right.
All right, thank you.
Thank you. Have a good day.
Bye.